Hello, ladies and gentlemen. And I know it's been a while since we've thought about patient education. So I just wanted to check back with you, and I just wanted to give you some reminders about patient education as it will be on exam number 4. So the class outcomes for patient education identify the importance of patient education, how it will promote patient-centered care, and its role as a standard in nursing practice. Identify the 3 domains of learning and their application to patient education, and then discuss how failure to provide appropriate patient education can result in poor health outcomes. So we will also identify how to assess a patient's learning needs, identify priority health topics for patient education, describe the different learning needs of age groups and specific populations. I'm really not going to address age groups because we deal here with the older adult, but I am going to speak to special populations. Explain the methods for evaluating learning, describe teach back, discuss the factors affecting a patient's motivation and readiness to learn, and then identify the barriers that are related to patient teaching and then patient learning. So, some key concepts. There is a firm grasp of teaching, learning, health literacy, and the learning environment that will allow the nurse to call to mind the information needed in the professional role when teaching patients in a variety of settings. So, nurses have been teaching patients about the value of good nutrition, fresh air, exercise, and personal hygiene since the days of Florence Nightingale. So, teaching has become progressively more important due to the following. Patients are participating more in their healthcare decisions. Patients and families require accurate, clear, and complete information so that they can make informed decisions. The more information they have, the better decisions they are able to make. Hospital stays are more brief. Patients are either discharged home, still requiring some medication, dressing changes, and skilled procedures such as urinary catheterization. So, nurses have a responsibility to teach family members how to provide this care and how to teach patients to care for themselves as soon as they are able to do so. So, and we know this, healthcare is expensive. Patient education can help to decrease the overall cost of healthcare. It does so by helping to increase patient understanding and compliance with medical and nursing regimens, which can shorten hospital stays, reduce the frequency of medical treatments and readmission, and improve outcomes and prevent complications. The basic purpose of teaching and learning is to provide information that will empower these clients and their families to, number 1, perform self-care or care to their family member, and 2, make informed decisions about their healthcare options. So, some teaching responsibilities. Nurses are responsible for educating patients about preventing and managing their health conditions and promoting their health. So, the benefits of patient education include the following. It will empower the patient to take control of their health care. It will improve patient adherence to prescribed health care. It will reduce health complications and hospital readmissions, and it will promote safety with medication usage. It will improve patient satisfaction, and it also increases the nursing role satisfaction. It increases the satisfaction that the nurse feels taking care of her patients. So the American Nurses Association, the ANA, the ANA's Code of Ethics for Nurses and Interpretive Statement holds that nurses are responsible for promoting and protecting the health, the safety, and the rights of patients. So, patient teaching is essential in fulfilling this responsibility. Registered nurses' teaching activities include the following: providing health teaching that will address topics such as needs, activities of daily living, and preventative self care, using health promotion and health teaching methods that are appropriate to the situation and the healthcare consumer's values, beliefs, health practices, developmental level, learning needs, readiness and ability to learn, language preference, spirituality, culture, and socioeconomic status. So, seeking opportunities for feedback and evaluation of the effectiveness of the strategies that are used, using information technologies to communicate health promotion and disease prevention information to the healthcare consumer in a variety of settings. And it is our responsibility to provide healthcare consumers with information about intended effects and potential adverse effects of their proposed therapies. So, the Joint Commission, these are the standards that require educators in healthcare organizations to provide education that is based on patients' assessed needs and to consider the literacy, the desire and motivation to learn, developmental and physical limitations, the barriers to communication, culture, and religious beliefs of every patient. So, the American Hospital Association's Patient Care Partnership, this was previously called the Patient's Bill of Rights, So the Patient Care Partnership describes in plain language the right of consumers to receive accurate and easily understood information about health plans, healthcare professionals, and healthcare facilities. So, people learn in 3 ways or domains: the cognitive, the psychomotor, and the affective. So each of these domains should be included when involving thinking, doing, and caring and feeling, when writing objectives and planning teaching and evaluation strategies. So, in this chapter, on table 16.1, there are the 5 rights of teaching. Ladies and gentlemen, please listen up one right now. Please know the 5 rights of teaching. Please know that table. So, cognitive skills are the mental activities for processing information. After capturing your patient's attention and getting them to perceive the need to learn the information that you are trying to teach, your goal is then to expand their learning beyond simple remembering and understanding. We actually want them to learn this information. So you will promote their thinking to a higher level that will involve applying, evaluation, and then creating ways to meet their own healthcare needs. Psychomotor learning will involve performing skills that will require both mental and physical. It requires the learner to value learning the skill. This is the affective domain, as well as understand and implement the skill. And this is the cognitive domain. So affective learning will involve changes in feelings, beliefs, attitude, and their values. So this is considered the feeling domain. So now let's talk about the factors that will affect patient learning. Motivation. Motivation is desire from within. The patient themselves have to want to do something. They have to desire the activity. They have to desire the result. So motivation is greatest. When clients recognize the need for learning, believe it is possible to improve their health, and they are interested in the information that they are being given. So in client teaching, try to apply the following principles for motivating your learner. Convey your interest in and respect for your clients to help motivate them to be engaged and successful in the learning process. Create a warm, friendly, and non-judgmental environment. Help the client to identify a practical need. Use rewards and incentives if necessary, and help the client to realize that health and safety really do matter. So then, readiness. Ladies and gentlemen, listen up, and then listen up one more time for me. Readiness. Readiness is the demonstration of behaviors that will indicate the client is both motivated and able to learn at a specific time. For example, a client may not be ready for teaching right before they are scheduled for a diagnostic test or a treatment because anxiety is going to make it difficult for them to concentrate on what you are saying. So clients should be ready to receive the information. They should be well rested, they not hungry, not feeling rushed. They should feel very comfortable. Ladies and gentlemen, please know the information on this slide. So, physical condition. Physical factors, for example, pain, how strong they're feeling, coordination, how energetic they're feeling, their senses, their mobility, and attention contribute to a patient's readiness to learn. So, for example, pain will interfere with the ability to concentrate on the teaching. The patient needs adequate strength, coordination, energy, and mobility to demonstrate psychomotor learning. And then patients with impaired hearing or vision will require adaptations to your teaching and evaluation strategies. Emotions. Ladies and gentlemen, listen up, and then listen up one more time for me. Emotions. So severe anxiety, stress, or emotional pain will interfere with the ability to learn. In addition, the learning itself and the idea that behaviors must be changed are going to create anxiety. So a mild level of anxiety can enhance learning by providing some motivation, right? I want to change. I want to be well. So for example, a patient that is newly diagnosed with diabetes may not be experiencing any physical conditions related to the disease as yet. So they may not be as motivated to learn as somebody who is actually experiencing symptomology to their disease process. Please know the information on this slide. So to continue, emotions. Ladies and gentlemen, listen up, and then continue to listen up one more time. The nurse may be able to motivate the patient by pointing out the potential and serious complications. For example, if we're dealing with diabetes, there is the potential for blindness and for kidney damage. So, we need to do this carefully so that the client does not interpret the words that we are saying as a threat. If you don't do this, this is going to happen. We don't want to do that. We don't want excessive negativity. We don't want to sound like we're preaching. We just want to simply give them the information and say, let's prevent your kidney damage by monitoring the blood sugar, by keeping your blood sugar in a stable range. Please know the information on this slide. Timing. Ladies and gentlemen, listen up, and then continue to listen up one more time. Timing. You must present information at a time when the client is open to learning. Timing is everything. So people will retain information better when they have an opportunity to use it as soon as it is presented, right? So I'm going to present this information to you, and then I want you to actually put it into practice. For some concepts, the client may need more time to absorb and apply information, especially when complex thinking is required. Ladies and gentlemen, please know the information on this slide. So, active involvement. Learning is more meaningful when the patient is actively involved in the planning and in the learning activities. So, for example, a demonstration with the return demonstration, teach back, and a patient education brochure is an effective way to teach patients how to perform a new skill. Feedback. Feedback is information about the client's performance. Please note, positive feedback will encourage clients who are tackling different content or devoting the time and effort needed to get the most out of the learning process. So this is especially critical when significant behavior changes are required. Repetition. The patient is more likely to retain information and incorporate it into his life if the content is repeated. For example, patients often forget what medication is prescribed for certain conditions. So repeating the name of the medication can help the patient remember it. Informing them of why they are taking this medication will help them to remember the name of the medication and why they are taking it. So, the learning environment. Ladies and gentlemen, listen up, and then listen up one more time. For most people, an ideal learning environment is private, quiet, physically and psychologically comfortable, and free from distractions. So if a separate space is not available, then find a quiet place, a quiet corner. Maybe you'll need to pull the curtain around so that there are no distractions. Close the door if you can. Sit down close to the patient, and you may want to talk in a softer voice, a more conversational voice. When you are planning a teaching session, provide good lighting and comfortable seating that is conducive for conversations. Please know the information on this slide. Scheduling this session. Ladies and gentlemen, please continue to listen up, and listen up again. Plan for uninterrupted time to allow you to adequately assess and understand the patient. The teaching time does not need to be long, it just needs to be uninterrupted. So, for example, I am not going to plan this when they are going for a procedure, when they are going for physical therapy. So, I just need, even if I only get 10 minutes, that is uninterrupted time, teaching can take place. Continue to listen up, ladies and gentlemen, please. Based on the patient's condition, whether it's activity tolerance, attention span, fatigue, or pain, shorter teaching sessions may be best for comprehension and then retention. Finding suitable time to teach can be a challenge, so even a moment can be a teaching session. On page 419, box 16.2, teachable moments, ladies and gentlemen, please know the information on this slide, and also please know the information that is in that box. Amount and complexity of content. The more complex or detailed the content is, the more difficult it is for most people to learn and retain. The greater the change, the greater will be the challenge for both the nurse and the patient. Communication. Communication is central to the teaching and learning process, in which nurses and clients exchange information, perceptions, and then feelings. So recognize cues to verbal and nonverbal feedback that the client may give. They can tell you whether or not the client is attentive and focusing on the learning activities. And then special populations. For clients who have special needs, so for example, those with a disability, if it's attention deficit hyperactivity disorder, otherwise known as ADHD, mental illness, affective or communication disorders, developmental delay, or if there is a brain injury, you must plan carefully to ensure that you maximize learning by adapting teaching strategies to the patient's special learning needs. For example, you may need to do one or more of the following. Plan brief, frequent learning sessions. Remember, repetition is always good. Pay special attention to minimizing distracting stimuli in the environment. Again, you want a quiet place, a quiet corner, no distractions. Present information slowly. Use repetition. Understand and be satisfied with slower progress. Everyone gets to where they are a little slower. You need to recognize that. Include a family member, a caregiver, or other significant person in the teaching to reinforce the learning and act as a safety net for implementing this information. And then health literacy. The Patient Protection and Affordable Care Act of 2010 defines health literacy as the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. So, ladies and gentlemen, listen up again. On page 421, table 16.2, incorporating principles of adult learning into the teaching of older adults. Please look at that table, and I want you to focus on the learning environment. Again, please note of that table, table 16.2, and then focus on the learning environment. So, health literacy does not refer simply to a patient's ability to read and write, but rather how a person can effectively find information and services to meet their health needs for themselves and for others, communicate health needs to others, and understand and apply information and services to meet those health needs. So, health illiteracy exists when the person is unable to apply language skills to understanding information about his healthcare. So learning gaps can occur in the following example. The patient has a hearing impairment and discharge teaching is done verbally. So the client fails to understand the words. No teaching took place. A healthcare provider uses medical terminology and jargon that is unfamiliar or misinterpreted by the patient, so this will result in an unintended message or lack of meaningful education. Limited health literacy is more common among the medically underserved community, minority populations, and the older adult. So patients with low health literacy are not as likely to understand the connection between risky behavior and health. They will encounter problems such as difficulty taking medications as prescribed, difficulty managing complex or chronic health problems, and a higher rate of emergency department visits, hospitalizations, rehospitalizations, and death. So, ladies and gentlemen, please listen up, and then listen up one more time. Promoting health literacy. To enhance understanding between you and your patient, refer to the following tips for promoting health literacy. For those with limited English proficiency, provide information in the primary language. use an online or a software translation tool or use an interpreter to translate. And we also need to know the client's literacy level. Speak using everyday words and plain language sentences. Use short sentences and easy to read words. Ask questions that will involve how and what rather than yes and no. Provide a take-home summary of the main points that they will need to remember. But please remember that it needs to be at the client's literacy level. If the reading level is too far above them, then that written information is not going to mean much. Please know the information on this slide. So you will assist patients in completing forms and/or health histories as needed, and then provide an opportunity for clients to ask questions. And ladies and gentlemen, on page 423, please listen up. On page 423, box 16.3, culturally competent teaching, please know the information in that box. And then barriers to teaching and learning. Barriers for the nurse will include there are competing demands on the nurse's time, for example, to prepare for the teaching, conflicting schedules between everything that the nurse needs to do in order to provide the education, and then the patient's availability to learn. Are they going for a lot of diagnostic tests? Are they going to PT? Do they have a lot of visitors? Ineffective coordination between the nurse's clinical demands and the client's best opportunity to learn. A barrier would be lack of space and privacy, interfering with effective patient education. Teaching is not seen as a priority by the nurse or the organization. That is a huge barrier. No third-party reimbursement for teaching. So the nurse is going to say, if I'm not going to get paid for this, why am I doing it? Frustration with the amount of documentation that it would take to document all of the education that the nurse is doing. And then some barriers for the learner. Illness, fatigue, and then other physical conditions. Anxiety or personal stress. Low literacy, low health literacy. Environment is not conducive to learning, and there is lack of time to learn. More barriers would include overwhelming amount of behavioral change needed, overwhelming complexity of the condition or treatment to be learned, lack of support and ongoing positive reinforcement, lack of motivation, willingness to take responsibility. There is a language barrier. The teaching is not suited to learning preferences and style. The provider uses jargon and technical terms, and the provider does not perceive the need for the information taught. Neither does the learner. So, ladies and gentlemen, thank you for your time and attendance. Please reach out if there are any questions or concerns. Thank you.